Well, hello, I'm Susan Moore with Spirit of Women and Banner Health. We're always interested in learning better ways of taking care of ourselves and, more importantly, our families and our loved ones. And that's why we're sitting down with Dr. Ryan McWilliams today. GI. And what is GI, Dr. McWilliams?
Well, GI is gastroenterology.
Okay.
Really, our focus is all the organs of the gastrointestinal tract. So we're really looking at the esophagus, stomach, small intestine, large intestine, but we also focus on the pancreas and the liver.
Wow. Does cancer make up a big part of your, when you're listing all those organs? I think, well, I've heard of pancreatic cancer and colon cancer and things like that.
Well, cancer certainly plays a role with almost every organ
Right.
system, and in gastroenterology, obviously, you can have tumors of the stomach, the pancreas, and probably more well known is colon cancer.
Right.
And colon cancer affects a large number of people in the United States and across the world. And
Should we just talk about colon cancer first?
Sure.
Okay. Is there a certain age you should really go, I got to go in and get this done?
I mean, if you look at it in general, so we recommend people start their screening colonoscopies at the age of 50. There are exceptions to that rule, and for African Americans, we recommend that they start their screening at age 45.
Okay.
Or if there's a family history of colon cancer,
Okay.
we do recommend that those people generally have their screening colonoscopies done earlier. And then there's some genetic causes of colon cancer, which those themselves also need to have earlier screening.
Okay. So I would go see a GI because I'm having problems, stomach ache?
If you felt that to be a gastrointestinal symptom, absolutely.
Yeah.
I mean, again, we're dealing with the entire intestinal tract. One of the biggest things that we deal with a lot of times is reflux disease or GERD.
Okay,
And
well, let's talk about GERD or reflux disease. Tell me what that is.
So if you take it literally, it's movement of stomach contents into the esophagus, and that's where the gastroesophageal part comes from.
Doesn't everybody have a little bit of that going on?
And it's actually physiologic. Everybody has some amount of reflux. It doesn't really truly become a disease until there's symptoms or quality of life problems related to it.
Okay. So, ulcers?
So peptic ulcer disease is a little bit different from reflux, and when we think of peptic ulcer disease, that's really lesions within the stomach or the small intestine, the beginning of the small intestine, and those are the ulcerations. And there's certain things that predispose you to that. A lot of the common medications that people take over the counter, like aspirin, ibuprofen, Aleve, those types of medicines actually can put you at risk for developing peptic ulcer disease.
And so would you say that's one of the causes of GERD?
No, not necessarily.
Okay.
Because there are actually two separate entities.
Okay, good.
I mean, GERD is either, most people describe their symptoms as either heartburn, which is kind of that burning behind the chest. Sometimes it even makes it up to the throat. And there's other symptoms that can come along with that too, in terms of difficulty swallowing. Some people can have some more pain type of symptoms related to it. If you look at typical symptoms, then you're also looking at kind of the reflux, which is people actually have sensation of the stomach contents coming up. And those are the usual symptoms.
Those are the symptoms, and then how do we treat them?
The symptoms are treated for the most part. We can actually fix people of the disease by just simple lifestyle modification. And so one of the biggest things, and especially in America as a whole, as we've become more obese of a population, we find that being overweight is a huge risk factor for developing reflux disease. So oftentimes if you are overweight, we just recommend that you lose weight. There are other specific things like raising the head of our bed to allow gravity to help actually do its job. And also not eating or drinking close to bedtime. You want to try to keep your stomach as empty as possible because again, when you're laying down, gravity's work is to bring things up.
And wouldn't that be a nice little added bonus if you are a little obese to keep your stomach empty once in a while?
Little motivation.
Yeah. Well, I'm hearing that you might be my neighbor. I live east of I-25, but if you get on Harmony and go west, I go right by the new hospital coming up.
Yeah, and so I will be working out there. I previously had a clinic here, but now I'm going to actually be helping the people in Fort Collins area at the new hospital. So I'm pretty excited to be able to do that.
Is there anything that you'd like people to know about you or your treatments or the new hospital that I haven't asked yet?
I think just in general, the way I think of medicine and being a provider for people, especially in gastroenterology, is I feel like I'm a motivated provider. I really want to be able to help people. And it's not just me telling you what to do. I see the patient-physician relationship as almost being a team and working together and reaching for goals. So oftentimes I will ask people, what are your goals out of treatment? And for some people, they've just been so miserable for so long that they said, if I could get to 80% of where I was before, I'd be able to have my quality of life back, to be able to go out and go back to work, or be able to go out and have coffee with friends or things like that. So I really like to set goals and work together to try to reach those goals and hopefully get people to 100% if we can, but that's not always possible. But it's really it's a team process, in my opinion.
Well, wonderful. I may be over to see you before you know it.
Let's hope not.
Yeah, I know. Well, hope not to see you too soon. Is that how that goes? And we are delighted that we had an opportunity to sit down with Dr. Ryan McWilliams, GI. And I'm Susan Moore for Spirit of Women and Banner Health.